Most people over 60 think that as long as they aren't feeling sharp pain when they use the restroom, their kidneys are doing just fine. But that's a dangerous mistake. The truth is, your kidneys can lose up to 80% of their function before you ever feel a single ache, cramp, or ounce of pain. By the time you actually feel sick, the damage is already done. Your body doesn't use pain to warn you about kidney trouble in the early stages. It uses your urine. If you're ignoring what's in the toilet bowl every morning, you're missing the only warning sign you're ever going to get. I'm Dr. Carl. I've spent the last 16 years practicing as a urologist, helping thousands of active seniors protect their bladder and kidney health so they can enjoy their retirement years without constant worry. Today, we are going to look at the 8 specific things your urine is trying to tell you about your kidneys right now. We'll look at the exact colors, textures, and changes you need to watch for every single morning. Pay close attention to number 5 on our list, because it's a bizarre visual change that many seniors mistake for a simple bladder infection, but it actually points to a completely different, silent issue that could land you in the hospital if it's left ignored. Before we dive in, I want to ask you a quick question. Drop a comment below and tell me what US state you're watching from, and if you've noticed your bathroom habits changing as you've gotten older. I read every single comment personally, and your answers directly shape the topics and medical insights I cover in my next videos. Let's start with the most common thing I see in my office, and that is dark yellow or amber-colored urine. Now, when we're younger, our bodies can bounce back from a little neglect, but after 60, our kidneys lose some of their natural ability to concentrate urine efficiently. Think of your kidneys like a highly sophisticated water filtration plant for your house. If that plant doesn't get enough fresh water flowing through the intake pipes, the waste product gets highly concentrated, thick, and dark. That dark amber color means your kidneys are working double time, straining to filter out toxins with a dangerously low supply of fluid. Research from the American Urological Association has shown that chronic, long-term dehydration is a primary driver for accelerated kidney decline and painful kidney stones in older adults. If you see this color, your immediate action step this week is to start drinking an 8-ounce glass of water right when you wake up, before you even touch your morning coffee. If you take a diuretic or blood pressure medication, just make sure you have a quick conversation with your doctor about your daily fluid targets so you keep everything perfectly balanced. The second warning sign is foamy or bubbly urine that just won't seem to dissipate. I'm not talking about a few bubbles that pop after a second or two. I mean a thick, frothy layer that looks like the head on a glass of beer and stays there even after you flush. When this happens, it usually means your kidneys are leaking protein into your urine. In a healthy body, the microscopic filters inside your kidneys, called glomeruli, act like a fine wire mesh colander. They keep the big, valuable things like protein molecules inside your bloodstream and only let the microscopic waste pass through. But when those filters get damaged by years of high blood pressure or blood sugar changes, the mesh gets torn and protein spills right out into the toilet. A major study published in the Journal of the American Society of Nephrology confirmed that finding protein in the urine is one of the earliest, most accurate predictors of chronic kidney disease in seniors. Your action step this week is simple. Buy a pack of over-the-counter urine protein test strips from your local pharmacy counter, or call your doctor's office to request a quick, routine urinalysis. It takes 2 minutes and gives you total peace of mind. Our third indicator is urine that looks pink, red, or cola-colored. Finding blood in the urine, which we call hematuria, is something that should always trigger an immediate call to your specialist. Sometimes you can see it clearly with the naked eye, and other times it's only caught under a microscope during your annual physical. Think of it like a leak in your car's brake line. It means a barrier has broken down somewhere along the track, from your kidneys down to your bladder. While it can sometimes be caused by a simple urinary tract infection or a small kidney stone from your weekend golf trips, many clinical reviews show that visible blood in the urine after age 60 requires a thorough evaluation to completely rule out more serious bladder or kidney growths. If you see even a flash of pink or red in the bowl, don't wait to see if it goes away on its own. Your action step is to call your urologist or primary care physician within 24 hours to schedule a non-invasive checkup. Fourth on our list is cloudy or murky urine, often accompanied by a sharp, pungent odor. Healthy urine should be clear enough to see right through. When it turns cloudy, like a glass of water with a drop of milk in it, it usually means there is a buildup of white blood cells, bacteria, or cellular debris floating around in your tract. As we get older, our bladder muscles can weaken slightly, meaning we don't always empty our bladders completely when we go. That leftover urine sits there, turning into a breeding ground for bacteria. According to data from the multi-center research bodies, urinary tract issues are one of the leading causes of sudden confusion and fatigue in seniors, even if you don't feel that classic burning sensation when you go. Your action step this week is to practice what we call double voiding. When you think you're finished using the restroom, sit or stand there for an extra 30 seconds, lean forward slightly, and see if you can comfortably empty those last few ounces that might be sitting at the bottom of your bladder. Quick pause here. If this information is helping you connect the dots about your own health, please take a brief moment to tap that like button. It takes 1 second, but it tells the algorithm to share this video with more seniors who need these warnings. And let me know in the comments, do you actively check your urine color, or is this the first time you've thought about it? I'd truly love to know. Now, let's move on to number 5, which is the teaser I mentioned earlier. Urine that looks completely clear, like plain tap water, even when you haven't been drinking much fluid. Now, you might think crystal clear urine is the gold standard of health, but if you notice this happening constantly, it can actually be a sign that your kidneys have lost their concentrating ability entirely. Imagine an old, worn-out water filter where the internal mechanism has degraded. The water just rushes straight through without any filtration happening at all. When kidneys begin to fail after 60, they sometimes lose the ability to hold on to water, causing you to pass massive amounts of completely diluted, clear liquid, while the actual toxins remain trapped in your blood. Many doctors are seeing this as an early sign of advanced kidney strain, or a sign that certain medications are overworking your system. Your action step this week is to track your fluid intake for just 48 hours. If you're drinking less than 4 glasses of water a day, but your urine looks like pure water, bring those notes to your next Medicare wellness visit. Sixth is a dramatic change in how often you have to go at night, especially if your urine stream feels weak or hesitant. If you find yourself waking up 3, 4, or 5 times every single night to pass just a small amount of urine, your kidneys might be struggling to keep up with their daytime workload. When you lie down to sleep at night, the fluid that accumulated in your legs and ankles during the day rushes back into your bloodstream, overloading your kidneys all at once. Research published in the Journal of Urology shows a direct link between frequent nighttime urination, known as nocturia, and increased fall risks in older adults navigating dark bathrooms. If this is you, your clear action step this week is to stop all fluid intake exactly 3 hours before you go to bed and elevate your legs on a recliner for an hour in the late afternoon to help your body process that fluid while you're still awake. Seventh on our list is urine that has a distinct sweet or fruity smell. This isn't a sign of kidney damage directly, but rather a sign of something that destroys the kidneys faster than almost anything else: uncontrolled blood sugar. When your body has too much sugar circulating in the blood, your kidneys try desperately to flush the excess out through your urine. It's like a factory conveyor belt that gets completely overwhelmed with inventory. The extra packages start spilling off the sides into the waste bin. The American Diabetes Association notes that long-term sugar elevation is the #1 cause of kidney failure in the United States. Your action step this week is to look at your last set of routine lab results from your doctor's office and check your fasting glucose and hemoglobin A1C levels. If you haven't had them checked in the last 12 months, call your pharmacy counter or doctor to get that scheduled. Finally, number 8 is a sudden noticeable drop in the total volume of urine you produce all day, regardless of how much you drink. If you notice that you're going to the restroom only once or twice a day, or that the total amount is just a few tablespoons each time, this can indicate a serious, acute blockage or a sudden drop in kidney blood flow. Think of a kinked garden hose. If the pressure drops or something blocks the line, the water stops flowing entirely. This is a situation that requires prompt medical attention. Your action step if you notice a sudden, major drop in your daily output is to monitor it closely for 24 hours, and if it doesn't improve, call your healthcare provider or visit an urgent care center for a quick ultrasound of your bladder and kidneys. To show you how much of a difference paying attention to these signs can make, let me tell you about a patient of mine named Robert. Robert is a 69-year-old retired corporate executive living out in Scottsdale, Arizona. He spent most of his days out on the golf course, feeling completely healthy, active, and energetic. But during one of our visits, he mentioned offhandedly that for the last 6 months, his urine had been looking consistently foamy, like soapy dishwater, and he was waking up 3 times a night, which was ruining his sleep and his morning energy. He assumed it was just a normal part of getting older, something he just had to live with. We ran a simple, routine urine test right there in the office and found significant amounts of protein leaking through his kidneys. Because we caught it early, before he felt any physical sickness or pain, we were able to work with his primary care doctor to gently adjust his blood pressure medication and tweak his daily hydration habits. Within just 8 weeks, his protein levels stabilized, his nighttime bathroom trips dropped down to just one, and his kidney function scores completely leveled off. Robert saved himself from irreversible kidney damage simply because he stopped ignoring what was in his toilet bowl. To make sure you can protect your health just like Robert did, let's look at tonight's simple plan. Here are 5 concrete action steps you can start tonight. First, look at the color of your urine every single time you go tomorrow morning to establish your baseline. Second, keep a bottle of fresh water on your nightstand and drink a few sips right when you wake up. Third, cut off all liquids 3 hours before you turn off the lights for bed tonight to protect your sleep. Fourth, check your online medical portal to see when your kidney filtration numbers, your GFR, were last checked. And fifth, if you see persistent foam, cloudiness, or a pink tint this week, call your doctor's office to request a simple 2-minute urinalysis strip test. Your kidneys aren't the only organs that send silent, visual clues through your bathroom habits before things turn serious. In fact, there is an equally hidden change that happens in your morning bowel movements after age 60 that most seniors completely misinterpret as standard aging, when it's actually an early warning sign of a dangerous vascular issue. I'm going to break down exactly what that looks like and what you need to check for in our very next video. I am Dr. Carl. Stay well, and I'll see you right there.